One.
Good morning, my name is Chuck Thompson. This is Lily Thompson. This is my 20-year-old daughter. She's going to be portraying the 17-year-old female patient today. So this 17-year-old female patient, she has struggled with mild persistent asthma for most of her life. And this is as evidence of her using her inhaler more than 2 times per week. She currently has a prescription for an albuterol rescue inhaler. She stated that she typically uses it 3 to 4 times a week, especially when she's around dogs or cats. When she gets sick, and needs to use like with a respiratory infection, she needs to use it more than that. Sometimes multiple times a day. Sometimes she gets woke up from her sleep. Exercise can sometimes bring on an attack, but mainly during the colder months. And she has never been hospitalized for any symptoms, but she has had to use nebulizers in the past during times when she has had sickness. So what is asthma? Asthma is, it's an inflammation of your lungs that's usually caused by numerous different types of triggers. As in your case, it sounds like your triggers are dogs and cats, cold weather, and sickness. When this happens, it causes your lungs to become inflamed and obstructs your airflow. The obstruction can cause shortness of breath, wheezing, and coughing. So how you currently treat it is with an albuterol inhaler. So since I already know you already have one, but you're not using a spacer, people a lot of times think they don't need a spacer. Those are for little kids, but they don't realize that this medication is coming at you at 60 miles per hour, so you're not able to properly inhale it, and most of it gets absorbed into your mouth, so you're not getting the dose that you actually need. And you should be using an inhaler, a spacer, to be able to use the medication properly. So when you use the inhaler, how you're supposed to use this is, first thing you need to do is you need to check the back here to make sure you have the proper amount of doses on there. If it's at 0, sometimes you may be able to spray it and something comes out, but that's not medication, it's just aerosolized. So you want to make sure that you have medicine left in here. All right, next you're going to shake it up. Real good, mix the medications up. Then you're going to get your flow chamber here, or your spacer. There's a flat spot on the end of your inhaler here, and there's a flat spot on the bottom of your chamber. You would line the flat spot with flat spots, put it into the end, okay? And then you would hold it up to your mouth. You would exhale, put your mouth on the mouthpiece, and as you push the medicine down, you're gonna inhale nice and slowly. Hold the medicine into your lungs for 5 to 10 seconds, and then exhale, wait a minute, and then repeat. Now, if you hear a whistling sound from that spacer, that means you're breathing in too hard. You need to do a little bit slower, okay? But that ensures that you get all the medicine that you're supposed to have. You're gonna do this, when you're having symptoms, you're gonna do this 2 puffs every 4 to 6 hours as needed. Now, if you're having a really bad flare-up, you can do it 4 to 8 puffs every 20 minutes as needed for up to 4 hours. But if you're doing it that much, you might want to consider seeking out medical attention. So dealing with your allergens, so the best thing to do is avoid them. But of course you can't always avoid them, because I know your family has dogs, your family has cats. So the thing that you can do is, as it says on here, you can need to, before being exposed to your allergens, you can take a medication called Zyzal. It's 5 milligrams. You can take it as early as possible that you know days you're going to be exposed to these allergens. Zyzal is a once per day, 2nd generation antihistamine, but the good thing about this is it does not make you sleepy. It doesn't make you drowsy, so you can still function with it. Now, say for instance you go around when your allergens, you don't know you're going to do it. You need to take your Zyzal. Take your Zyzal as soon as you can after you're exposed, and if you need to use your inhaler, again, use it as you needed. 2 puffs every 4 hours is needed. For exercise, your lungs don't like cold air. That's why your body naturally humidifies the air going into your body. It warms it up, filters it out. Well, when you're exercising, you're breathing really fast, so it doesn't get that warm air like it's supposed to. When people like you who have asthma, that cold air can trigger an asthma flare-up. And so to try to prevent that, you can pre-medicate yourself. So before you exercise, 10 minutes before you exercise or 10 minutes before you go out to the cold, you can use your inhaler. 2 puffs, just like we instructed earlier. When you're sick, this is a big thing. I know this is when you've had lots of problems in the past. So when you're sick, like with a respiratory infection or anything like that, you need to start pre-treating yourself as early as possible. And how that looks like, you're gonna take your Zyzal once a day. You're also gonna use Flonase, 50 micrograms. You're gonna use 2 squirts up each nostril, once a day, Or if you don't like it that way, you can do 1 squirt up each nostril twice a day. You're gonna do those medications for the duration of your illness. Now, if your illness persists for over a week, you need to follow up with your primary care physician because other medications may be needed. Or if it's getting to where the inhaler's not helping you, because you can also use your inhaler every 4 to 6 hours is needed for your cough and your wheezing, shortness of breath. But if it gets to where your inhaler and the medication's not working, you see that you're waking yourself up over and over and over in the middle of the night, definitely need to follow up your primary care. Or if it gets so bad, you need to follow up with emergency help through either urgent care or an ER. Now, there is a thing that can happen called asthma exacerbation. This is when your asthma flare-up happens so bad that you can't, your inhaler's not working, the rest of your inhaler's not working, and you cannot deal with it anymore. And what this looks like is that you can only speak in 2 to 3 word sentences without having to take a deep breath. You can't walk across the room without losing your breath. And you're just struggling to breathe. And if your inhaler's not working, you need to seek out emergency attention then. Either call 911 or go out to the emergency department as soon as possible. That way they can give you other medications that can help you, because you don't want to get that far. Okay, I prepared this whole packet for you right here to take with you. Do you have any questions or anything?
Nope, I think you answered all my questions.
Awesome. All right, well, you have a good day.